Do you have PCOS and you're wondering whether birth control pill is good for you? Well, stay tuned because I'm going to be going through the pros and cons of birth control pill for PCOS. So if you have been watching my videos on this channel before, you know that I speak a lot about PCOS. So if you haven't seen the natural alternatives to metformin as well, please make sure that you check that video and check my videos about hyperandrogenism. The reason why I'm mentioning it is because those are usually the most typical medication prescribed for PCOS. Metformin, spironolactone, and now also birth control pill. So let's go straight to it and let's go through pros and cons. So first of all, we have few pros. First thing, it is an effective pregnancy protection. Birth control pill has 91% success rate if it goes to preventing pregnancy. So if you are not planning to have children anytime soon, it will definitely do that, while at the same time making your symptoms a little bit better through the duration of the therapy. Second thing, as I just mentioned, temporary reduction in symptoms like acne, hair loss, etc. Due to the fact that birth control pills has a synthetic hormones, it actually puts you into artificial state that is confusing your body a little bit, but thanks to that, it's reducing hormones that are responsible for acne, hair loss, and so on. The important thing is to know that this is just through the duration of the therapy. Now, number 3, predictable and light bleeding. So for all of you who have quite heavy bleeding and you are not sure when your next period is going to come, birth control is kind of regulating it, and by that I mean that your bleeding is coming regularly, but we are going to go through what this bleeding really is in a minute. Now, next thing is a 1-a-day solution. Now, if you think about changing in your diet, your lifestyle and your supplementation, it takes a little bit more effort than just doing something one time a day. So definitely birth control is just easier. Now, the last one, it also helps with other hormonal issues. Now, let's be honest here. Sometimes we have very, very bad hormonal problems and they can cause you, for example, to bleed for months and months on end. So in this case, it can definitely help you regulate it while you maybe work on your problems in a different way. Now let's go to cons. So when we're talking about the cons of birth control, there's also 5 of them that I listed here. So the first one is going to be it doesn't actually fix your hormonal problems and can make some of them worse. So for example, if you have problem with thyroid, if you have also problems with thyroid hormones, this can exacerbate them. So if you take this extra estrogen, your body needs a little bit more thyroid hormones as well. So this might cause a little bit of a problem. Also, if you have problem with progesterone, that can be not the greatest solution for you. And also, because it says that it doesn't fix your hormonal problems, it kind of masks it, it's kind of putting a patch over the problem. So as soon as you go off the birth control pill, your problems are gonna return. Because it's not fixing anything, it just puts the plaster over it. Now, second thing, it drives inflammation. As you know, there are 4 types of PCOS. One of them is inflammatory PCOS. And if you already have inflammation in your body that we very often have, even if it's gut issues, even if it's joint pain, stuff like that, birth control pills are actually making it worse. And it can cause, in turn, even further hormone disruption in the long run. Another thing is that the bleeding is actually not normal. So this is not your period. Period is called something that comes after ovulation as a part of natural female cycle. However, because you're disrupting ovulation and the ovulation doesn't happen, then the bleeding is actually not actual bleeding. And why is that important? It's because you have to know that the fact that on birth control pill your periods are coming regularly, it doesn't really mean that your periods are regular. It is just artificial bleeding from actually stopping taking the pill for a week. Now, another thing that is a little bit more broadly discussed nowadays is that it actually creates significant nutrient deficiencies. And there are quite few of them. It's zinc, is coenzyme Q10, it's selenium, is magnesium, but it's also more than that. And that in turn, of course, can cause a lot of other health issues, like for example, having not enough selenium can then turn into thyroid issues and so on and so forth. So unfortunately, as we all know, our health is in our gut. So if we have nutrition nutritional deficiencies, it can then cascade to a lot of different problems. And the last thing, it increases our oxidative stress. So in turn, it speeds up aging, it can flare up all the autoimmunity disorders, it can raise inflammation, as I mentioned, and that in turn impacts our overall health. So should you go on birth control pill or not? In my opinion, if you have severe symptoms like severe acne that is actually causing you pain, or maybe you have extreme hair loss, or maybe you have extreme hair growth, I would recommend maybe trying birth control pill, but working on changing your lifestyle and diet in the meantime. And after a while, when you know that your lifestyle is already better, when you maybe worked on your insulin resistance as well in the meantime, try to wean off of birth control. Unfortunately, like every medication, birth control pill has a lot of side effects. And this is everything, like including possibility of being obese, diabetic, including risk of heart disease, including risk of stroke, and many more. So take that under consideration, and if you can, don't take the simplest route, maybe combine the two or try to work naturally. If you haven't seen my playlist about how to reverse insulin resistance that is a cause of many of our symptoms, please make sure you check that playlist, and also like, subscribe and click the notification bell to be notified about our future videos. And let me know in the comments, are you currently on birth control pill? Are you using it right now, and how is your experience? Me, myself, I went off birth control after 15 years going on and off it, and it took me 3 years to start feeling good after that. So let me know your experience in the comments, and I'll see you soon. Bye.